How does hospice treat infection when we're not actually testing for infection anymore? Hi, I'm Chelsea, the palliative PA, and I wanted to answer this question because this is an important one. Hospice essentially is comfort-focused care, but people can be on hospice for months. So in that time frame, sometimes people are going to get infections like urinary tract infections, pneumonias, sinus infections, cellulitis of the skin, things like that. How does hospice actually treat those if they're not testing for those, like doing a urine sample or getting a chest x-ray? They're treating these exactly like they treat everything else, which is symptomatically, meaning if you get a cold, which is typically a virus, usually they're going to treat it the same way we would treat a virus in the outpatient setting, which is just supportive care. So Tylenol, ibuprofen, fluids, cough medicine, cough drops, whatever it might be. But say that cold lasts 10 days or 2 weeks or isn't getting better even after that supportive care, then we're going to do the same thing that we would do outpatient, which is give an antibiotic because it's probably not a virus anymore if it's not getting better on its own. Hospice nurses and hospice providers have a stethoscope. They can listen to the lungs. And if the lungs sound really crappy or we hear kind of crackles in one lobe and somebody is sick and having a fever, then we think maybe they have a pneumonia and treat them with antibiotics. With a urinary tract infection, it gets a little trickier because of course they're not going to do a urine sample to see if there's specifically an infection, but a lot of times if someone is complaining of the typical symptoms being pain when they pee or going to the bathroom a lot or something out of the ordinary, then they're going to treat with antibiotics and just see if things get better. It gets trickier in the older population because a lot of times urinary tract infections don't always present as typical symptoms. So they can present more as agitation, confusion, delirium, other types of things. So if those things are happening and there's not really any other reason for it, sometimes hospice is going to just treat for a UTI if it's appropriate and see if it gets better. And if it doesn't get better, then sometimes this can be the decision of, do we just treat the symptoms and let someone potentially pass away? Or is it time to potentially go to the hospital and have testing done if the symptoms are becoming really problematic and they're not being well controlled at home? So thank you for this question because I find this is a very important topic to discuss. As always, keep the questions coming. I'm happy to answer them and follow along for more.